The strengths of what we do at rtNOW is that we put a patient in a relationship with a respiratory therapist. That is the secret sauce of what we do.
How does rtNOW make a DME's team of respiratory therapists more efficient instead of just replacing them?
There's a respiratory therapist shortage, and there was before COVID. There's not enough people to replace the respiratory therapists that are leaving the field. If you're a DME and you're fortunate enough to have a respiratory therapist, the last thing you want to do is put them on CPAP education when they should be out setting up event or doing something else that's really important for them to do.
When you talk to these DMEs, from their perspective, what do you think is their number one challenge in respiratory care in general?
I cannot imagine the difficulty of a changing landscape where the amount paid to you and how it gets paid to you changes as frequently in this particular industry. We just come alongside them. We create solutions. And that's one thing about rtNOW is we're always on the cutting edge. I've always thought that the hospital's moving to the home environment. And that's been kind of my mantra here internally for the last 10 years is that you got to get ready because the hospital's going to come home. We've already seen it in a lot of ways.
Okay, we are live in the Claim to Fame podcast. We have Justin Hawley on the podcast. Welcome to the show, Justin.
Thank you, sir. Thanks for having me, guys.
Yeah, welcome, Justin. Happy to have you on.
Thank you.
So, Justin, you've kind of been called the co-inventor of telerespiratory care, something that AARC credits rtNOW with kind of pioneering. That's a bold title. Can you take us back to the beginning? How did this idea even start? A little bit about yourself?
Yeah, sure. Well, my background is in communications. So I was hired I had a communications company here in Rochester, Minnesota. And at the point in time, I had many of the large clients in our area. So a very large medical facility here, I can't say for legal reasons their name, the university in town, University of Minnesota. And I was at one point in time doing a joint video for those two entities. And I was subsequently hired out of a job I was at later to join a company that did nothing but per diem respiratory therapist staffing. It was called Core Respiratory Services. And their goal was to kind of change the way respiratory therapists that were doing contract work were looked at in our area, because I think at that time they were, maybe not the best and the brightest of respiratory care were going into the contract staffing. So they started this, and it was started by 3 people, one of whom, went on to be a respiratory therapist of the year in Minnesota. And, the others have their own wonderful accolades as well. And so they wanted to change that perception. So I was hired into there, and, they'd be sending respiratory therapists out to critical access hospitals for, they'd drive 4 hours and they'd have to do, an assessment or something. And then they drive 4 hours back. We had to bill for that entire time period. And I thought to myself, this is in nobody's best interest, right? It's not scalable, it's not sustainable. And so I just started asking questions. I looked at the technology that was available at the time. And my experience with clinicians, which I'm not a clinician, I'm for a long time I was the black sheep of the company because I was the only non-clinician amongst 40 respiratory therapists. My experience with them, though, is that if you start asking questions like, can this be done another way? They'll all of a sudden kind of come out of their box and look around and be like, oh, wait a second, there's, we could do this, I suppose. We could do that.
Right.
So, yeah, and so we piloted it at a critical access hospital in Sleepy Eye, Minnesota. And it went so well, it was funny because after we pulled out of there, after the pilot, the nurses raised enough of a concern where they asked us to come back into the hospital. So it was, the pilot and then the first client completely based on the clinician response to the program. So started there in the inpatient side and then, kind of grew it. And then a couple of years ago, we switched to really focusing on the DME world, which is where our paths crossed as well.
Justin, for our listeners that don't know about RT yet, can you walk us through how DME might use your HME services, things like remote PAP setups, adherence support, or ventilator follow-up?
Absolutely. So we're always on the cutting edge. We basically, I think for all intents and purposes, we pioneered this trail with remote PAP setup and adherence. Those are still classic lines we have. So we can set them up virtually. We can do a 90-day adherence for them. And we also recently announced a brand new service set that it goes along with the CMS National Coverage Determination rules that affected BiPAPs and NIV. And so we took a look at those rules. We took a look at what we're doing, which the strengths of what we do at rtNOW is that we put a patient in a relationship with a respiratory therapist, right? That is the secret sauce of what we do. And we're able to do it across the entire United States, which is no small feat considering, there's not a compact. It's not like nurses or doctors where they can work from one state into another. You literally have to be licensed in every state, which is hopefully changing in the future, but that's the reality of it, right? So if a patient comes now and they fall into this problem where they have chronic respiratory failure after COPD, well, we will still take them with and do a PAP setup for them virtually, but then we can move them into a 6-month adherence program. And with that, you need to not only be compliant, but you have to prove that it's effective, which we do by showing an improvement in the symptoms. So after that, we also highly recommend that they're enrolled, and I'm speaking about BiPAP and NIV here, into our quarterly follow-up program as well. So in that, we use a SOAP note and document the patient's symptoms and improvement. We check the vent settings. We document the hours used, the settings, the alarms, those kinds of things. And that meets the CMS requirements for continued eligibility. And then after that, we've got an ongoing adherence program for all of the devices as well. So we take a weekly look at the data. We reach out to them if we believe they need to be reached out to. And then we escalate back to the client if there is a problem. So that's kind of what we do. And that fulfills all of the requirements that CMS put here, as well as it sets them up very well for resupply as well.
That's great. How does rtNOW make a DME's team of respiratory therapists more efficient instead of just replacing them?
Yeah, well, there's a respiratory therapist shortage, and there was before COVID. Like when we started this, in 2015, there was a shortage of respiratory therapists. What we've seen since COVID is that, there was immense burnout. There's not as many people, even if that wasn't a factor, going into the field, there's not enough people to replace the respiratory therapists that are leaving the field. And so if you're a DME and you're fortunate enough to have a respiratory therapist, the last thing you want to do is put them on, CPAP education when they should be out setting up a vent or doing, something else that's really important for them to do. So what we do is we call ourselves a pressure release valve for their respiratory therapist, right? You don't want to burn them out. You want to keep your respiratory therapist happy. You definitely don't want to be calling them nights and weekends and having them getting calls from, for things that they don't need to be bothered with. That's how we come into the picture.
Gotcha. And when you talk to these DMEs from their perspective, what do you think is their number one challenge in respiratory care in general? Is it staffing shortages, thin margins, all the above? What are you hearing from your end? And how do you guys help?
Wow. I think all of the above is probably the best answer, right? I mean, I'm an entrepreneur, and I cannot imagine the difficulty of the changing landscape where the amount paid to you and how it gets paid to you changes as frequently as it does in this particular industry. So we just come alongside them, and we create solutions. And that's one thing about rtNOW is we're always on the cutting edge. There's not another respiratory company that's usually going to come invent a service line before we do, or test it out and really invest the time and the energy. We've had imitators in some of these areas now, whereas for probably 5 years we had not even any competition. We were just that far ahead. But through all of that, we've never watered down our service, right? We're not hiring somebody from McDonald's, training them, and then calling them a sleep coach, and then trying to escalate to a respiratory therapist. Like, you have a patient, we want to tear down all obstacles getting that patient with a respiratory therapist. That's what we do to empower respiratory care. So yeah, there's a lot of challenges for them. We just simply exist to remove the obstacles and to let the billing happen so that they can be there for the patient when they need to be.
Justin, you say that you're passionate about positioning companies, and I'm a marketing guy. That's what I do here at Nico Health. So I know all about positioning and making sure that where your brand sits in your ideal customer profile's mind is where it should be. What's the secret to positioning a business in healthcare in a way that others really can't easily copy?
I think there's a lot of different approaches to that. and so depending on who you talk to, some people are going to try to compete on, price. Some people are going to try to compete on this or that. My belief in positioning is very much was it Sam Walton, the creator of Walmart? Like, he had a belief that you go where they're not, right?
Mm-hmm.
And so when I see a mountain that the industry is unwilling to climb over, I don't see the obstacle necessarily. I see the opportunity to create a path for the people that follow me. And by that, I mean the clients and the respiratory therapists, which is also going to be very difficult to imitate. And that's part of why we're still here. We've just, like I said, the respiratory staffing alone is an incredible amount of work goes into that a lot of companies just simply don't want to look at. So that's one of many different ways where we're willing to tackle the hard problems, and there's an Italian word called, it's like sprezzatura or something like that. And it means making the incredibly complex simple, right? You look at a Ferrari or a Lamborghini or whatever. That's what we do. We take the incredibly complex and we make it simple and we hand it over to a DME.
It's like any great brand that of Apple, for example. They could take something that's a kind of a difficult concept to wrap your head around, whether it's like the hardware, the software, and make it so easy to use that even my grandmother can FaceTime me now.
Yeah, exactly.
Justin, looking back, what was the first time that you realized this isn't just a business, this is actually going to reshape the entire industry?
Man, you guys ask great questions. Oh, wasn't prepared for that one.
Or did it just, sometimes these things, it's not like a light switch. It just kind of happens. Just, it wasn't always like this, right? It's, especially before COVID, right? There was, Zoom obviously blew up, Microsoft Teams. Was it just like a gradual progression, or you're like, okay, wow, this is going to become bigger?
There's two different moments that one was a moment, one was a gradual understanding. The first one was we were going out to conferences and we thought we could start with the basis of we're a respiratory therapist telehealth company, right? And we quickly found out that in the pre-COVID years, that wasn't good enough. They didn't know what telehealth was.
Yeah.
So, taking the mentality, when you try to sit on the edge of the future, and you have to realize that, there are people out there running hospitals and DMEs with Post-it notes and have no idea what is possible. You had to kind of redefine what your key messages were at that point. So that was one of the big ones, just understanding where the industry actually was. The other thing was a gradual realization of both how underappreciated respiratory therapists were and what they did, and that there was so much more that they could do that was completely untapped. And this will probably, I'm sure we'll talk about technology and future stuff, but those were a couple of things.
Sure. Yeah. That kind of leads me into my next question. Like, what role do you see telehealth and remote services playing in the future of DME industry right now?
Crucial would probably be the word that comes to mind. I've always thought that the hospital's moving to the home environment. And that's been kind of my mantra here internally for the last 10 years, is that you got to get ready because the hospital's going to come home. And we've already seen it in a lot of ways. And DMEs need to be prepared not only for changes, like many of your guests have said, but what is the value that they're going to add to the customer, right? It can no longer be, this is where you get your supplies, because there's still some older generations aren't as comfortable ordering on Amazon, but us and below us, the first thing I'm going to do is see where I can find it. And my kids are just going to ask their AI agent, find me the cheapest price on this, and they're going to do it.
Yep.
So there's got to be some value that's added. And I think that value is going to have to come into terms of relationships and services that they provide that are above and beyond the norm.
That definitely agree. Is it safe to say you think every DME will eventually need some sort of telerespiratory services?
Yeah, I think so. I mean, I can speak specifically to respiratory care, of course, because that's what we're engaged in. But I think there's a lot of areas where people are just going to simply be unwilling. A I have a direct primary care subscription, right? And I don't like going to the doctor any more than I have to. I go there when I have to. If I can talk to my doctor on the video, great. But I think it's the direction everybody's going, because we're raising kids in an environment where the old factory mindset doesn't apply anymore. I mean, even schools are having a tough time now because families can do it without them, and they can do it better.
Right.
Yeah. So, when you're innovating in healthcare, it's definitely easier said than done. And there's always resistance and hurdles at some point, usually in the beginning, and things hopefully get easier. What's been the biggest challenge convincing organizations to adopt telerespiratory care? And has it gotten easier post-COVID, or what's some thoughts on that?
It's definitely easier post-COVID. Yes.
Yep.
Everybody's comfortable with it.
That's awesome.
I think the biggest problems that I see have to do with the healthcare system in general. I think it's in some ways it's the worst of both worlds, right? I'm a Austrian economist, capitalist. I think the reason people are moving to cash pay services right now is because what we have sucks, and the places that are trying to do it all under the government banner. We get, like I said, I live in Rochester. I see people coming down from Canada, because they have to wait 6 months to see a pain doctor, right? That's not healthcare. That's a symptom of an extremely broken system.
Couldn't agree more.
Yeah. So most of the problems that I see honestly, if we could get, this is going to be a word a lot of people don't like, but deregulate some of the nonsense out so that we can get patients in front of clinicians, and let technology, pave the way for that relationship and interaction. I think we would see a lot of healthcare changes overnight. Whether or not that will happen, that's who knows. But
that kind of leads me to sort of the next question about where you see the future of the space. rtNOW today spans HME services, RPM, inpatient, outpatient support. What does the next 5 years look like for the company, in your opinion?
yeah, we're doubling down on HME actually. So we're redoing our entire tech stack right now to make it more applicable for the direction we want to go, to position ourselves where we want to be. And we're going to be offering services we haven't offered yet specifically for DME companies. We really do believe in the relationship they have with the patients, and we want to foster that. So as long as, it's interesting in my position because I meet with probably about 50 cutting edge tech companies every quarter. And the ones that want to try to do everything with tech that historically have been relationship based, they end up either coming back in 13 months and wanting to work with us, or they go out of business. I mean, I can almost mark that on my calendar now.
Wow.
And so we live in a world where children have grown up having to be isolated from other people. And I think there's going to be a resurgence of relationships and community in the future. And I think that's an area where we excel and we can help DMEs.
That's great.
Yeah, I feel like with those type of things, there's like a boomerang effect, right? Like everybody's so on their phone, and that's where they're doing their connections. But I could definitely see it, like, especially after COVID, like the bounce back of in person everything. I totally agree with that. This is kind of just not a random question, but I like to ask people this: if you could go back to your younger self right before starting rtNOW, you have a lot of insight into the future and great opinions. In my opinion, what's one piece of advice you would give yourself all the way back then, based off kind of what you know now?
I'm a big believer that this, I see the big perspective in terms of this life is temporary and short. So I first take an eternal perspective. I love the Lord. I'm a Christian man, and so the first thing I'd say is just hang on to Jesus. When it comes to the medical and industry part of it, though, in business in general, I would just say continue to do the right thing and do it as good as you possibly can, and the clients will come. Everything else will come. You just got to be better than everybody else, and you got to do it the right way, because it's I know you guys, and I know what some of the things you've gone through, and we've gone through the same things. There are people in this industry that will be meat grinders, and they want to, rather than keep a client based on value, they want to put their hooks and their talons in them and not let them leave. And in the meanwhile, they're shaking them for every penny they got, right? And I believe that there's days of reckoning coming for companies that do that. And
Sure.
and that's why I'm happy to be here when I say yes to doing this, is because you're part of the solution. You're not part of the problem.
Absolutely. There's definitely a lot of changes that are slowly but surely happening, and I truly believe it's only going to speed up. And people are trying to get away from like this single tech stack or service black hole and have some autonomy on who they work with. So we take a lot of pride in saying, hey, you know what, the hub and spoke model is kind of back, in my opinion. I think like 6 or 7 years ago, whether it's for convenience or maybe not as many options, they were okay having all their eggs in one basket. But there's a lot of exciting groups of people innovating that we want to give our clients the autonomy to find who makes sense to work with and make it easy to do business with. So I think there, in regards to resurgence, I definitely think that mindset, and I just noticed it on the dozens of phone calls I do every week. People saying, hey, they might have found a technology that I'm not even familiar with, but we give them flexibility to work with what makes sense for their business instead of just shoving them in a corner.
Absolutely. Absolutely. I mean, life's pretty simple when you look at it that way, right? Just do your best. And it takes, once you get in a big company and you have to make critical decisions, it takes a lot of bravery to say, we need to do the right thing. And it may take a financial hit, but if you really believe in your team, you believe in your product, you believe in your people, you're willing to do that, and it will come back to you as long as you just keep doing what you're doing. So.
Right. If you're doing the right thing, you're solving problems for people, and you have the right head on your shoulders, I think you could be successful. But Justin, I think we could wrap up and go to the rapid fire, if that's okay with you. It's usually what we end our segments with. It's kind of a this or that section of the podcast, how we usually end up every podcast. So let me know when you're ready. All right, cool.
Okay.
Big dream or small win?
Big dream.
Start with the story or start with the data?
Start with the story.
Work late into the night or wake up before sunrise?
Work late into the night.
Risk taker or cautious planner?
Both.
For sure. Read a strategy book or write a story?
Write a story.
Innovation or execution? That's a tough one, I know.
That's the only brain buster one, I think.
I'm just going to say innovation, because at least you're going to fail out of that, and then you're going to execute better next time.
Boom. I love it. Well, Justin, if anyone wants to reach out to you or find out more about your company, what's the best way they could do that?
Yeah, rtNOW.net, rtNOW.net, and we're all easily accessible. I'm Justin at rtNOW.net, and we have sales contact forms there as well. And we would love to serve any DME, that wants to do things the right way and really get their patients in contact with clinicians that care about them. And our long-term strategy, we want to take them, we call it sleep to peak, right? We're taking them from sleep all the way into sometimes into life.
Yeah.
We'll be there every step of the way, working side by side with the DME.
Excellent. Well, Justin, thanks so much for coming on the Claim to Fame podcast. For our viewers who have not yet subscribed, please do so. Thanks so much for coming, and hopefully we can do this again.
I look forward to it.
Have a good weekend.
You too.